And we're delighted to present at this meeting SWOG 1314. So this is a randomized study looking at 2 chemotherapy regimens in muscle-invasive bladder cancer. So it represents one of the only prospective data sets in this population comparing 2 chemotherapies. And it really was designed to study a statistical biomarker approach called COXEN to see if we could predict which patients can respond to chemotherapy.
Thank you. And what sort of methods did you use?
So COXEN is a mathematical design, and interestingly enough, it starts with in vitro data, so cell culture data, which is humanized by correlating with human samples. So essentially, you pull out from this in vitro cell culture data the relevant human markers. And then that signature, that gene expression signature, can be applied to individual patient's tumor to say, will this patient respond to these chemotherapy agents? So this represented an important study for the bladder cancer community. It was a federally sponsored trial by the NCI and enrolled over 230 patients. There are 2 biomarkers we looked at. One was for gemcitabine-cisplatin, the other was for a chemotherapy called MVAC, MVAC. So the MVAC biomarker didn't perform very well. The gemcitabine-cisplatin marker for its individual arms showed separation which did not quite meet statistical significance. However, if we put all the patients together treated with both regimens, it had a p-value of 0.02 in selecting those patients that would respond to chemotherapy with a pathologic response at the time of surgery. I think there's a lot of potential impacts from this work. So one is the COXEN biomarker, which we are primarily endeavoring to look at. This will give us a lot more opportunity now to take this data, refine it, perhaps at different thresholds, perhaps look at different ways of using that particular approach for biomarkers. In addition, again, this represents one of the only prospective randomized trials in muscle-invasive bladder cancer, so an important set. We're going to look at DNA expression, microRNA, we're going to look at SNPs, and a variety of other correlative biomarkers are in play. The hope from all of this is we can generate enough data to direct therapy for patients in the future.
And how important is the use of a biomarker, particularly for these type of patients?
So it's interesting, for bladder cancer, muscle-invasive, before patients go into surgery, there's 2 acceptable regimens. There's gemcitabine-cisplatin and Midostaurin's MVAC. Right now, providers basically just pick one. And if you ask them why, there wouldn't be necessarily a systematic way that they would pick one over another. The hopes of this biomarker and really all the other things we're doing is, can we have an approach where there's a thoughtful, a customized way of saying, this patient should get chemotherapy regimen A and this patient gets chemotherapy B. That's the real hope of this. I think it's a step forward. We'll need to continue to work.